So you've been treating and clearing up gum disease or bleeding gums, bad breath, loose teeth for many years.
Yes, yes. It's called gum disease, but when it goes into bone disease, that's when it gets serious because it's non-painful.
So what is it? Define it. I mean, what is it?
It is a certain kind of bacteria that are allowed to live below the gum, and the body sees it as a foreign object. So the body goes to kill this bug, but it goes in such fury that it overreacts. It's kind of like having hay fever, but it's in the tissue. What causes it is a bacteria that's allowed to stay below the gums, and the body has a violent reaction to this particular bacteria, and so it just explodes. It creates pus. I mean, it gets swelling. It gets bleeding. And if you touch your gums and they bleed, they need. So, I mean, you've got perio. If you floss and you bleed, you got perio. And the results are bad breath, and this gum disease has a very special smell to it that when you pick up on it, you can smell it almost across the room. And what's happening is all this, I hate to say I'll just say infection,
okay,
instead of getting into the bad words. That has to be cleaned out of there. If it's left, that infection is going to be like Pac-Man, and it's going to just keep.
But you do that all the time.
Every day. That's what the hygienist does, and that's what she's skilled at. And I mean, we make you numb. We can give you nitrous oxide. We can even do sedation.
But that's how you lose your teeth, right?
Well, that's the biggest reason that people lose their teeth is a bacterial infection that eats away the bone. The bone gets loose. It's never painful until it's too late. So pain is not an indicator of health. Just because you feel that they're okay, that doesn't mean that you're okay. It's the silent killer of teeth.
But for sure, if you have bleeding gums, that's bad.
If it bleeds,
like even a little blood when you're flossing?
Even a little bit of blood. You know, zero tolerance for bleeding. Zero tolerance for bleeding. So you could use, and the Waterpik is great. And the flossing
Waterpik's good, okay.
Yes, Waterpik is good. You think you've really done a good job, and you get the Waterpik out and lean over the sink, and the food still comes out. So we like to if people like to lose weight, we like to put people on the dental diet. And the dental diet is that when any little piece of food gets in your teeth, you got to get it out, because once you feel how good it feels, you want to keep it clean. So when you do that, okay, then you don't snack.
Okay, interesting.
Because you got to clean your teeth.
Okay.
Because you can't stand it.
So the bad bugs, this bacterial infection, lives off food that gets trapped under the gum line?
Yes, absolutely.
So if you Waterpik it out, it doesn't thrive?
Clean teeth.
Is that what you're saying?
Clean teeth, clean gums don't rot. They don't get infected.
So you got to have the Waterpik.
You got to have the Waterpik. You got to clean your teeth. You got to go to the hygienist. You got to go to the hygienist that you like and you enjoy going to, so it makes it comfortable, which was what Teresa's been with me for 38 years.
38 years? 38 years. She's been doing that?
Yes, for me.
Now you like what you do. Why do you like it so much?
Because of the results, because of the people I work with, because of the things I get to do on a day-to-day basis, and still learning. You know, what's exciting about dentistry is there's something new every day, and keeping on top of the game is just a challenge to me, and I love it.